We are the first generation to live longer and feel worse.
Diagnosis or not, we are carrying this burden.
The people talk about fatigue, the brain fog, the ongoing pain, the inflammation that just never goes away. And these things are just things that aren't rare anymore. They're everywhere. The body is under too much strain. And more research shows actually that these symptoms are real. We can measure them in the body. Environmental toxins, immune system stuck in overdrive or metabolic dysfunction, and of course the relentless pace of modern life.
There are over 1 billion people in the world that have chronic illnesses.
Heavy metals, solvents, pesticides, microplastics, inflammatory markers, lipids. These and many more are the burden we carry.
When illness has many causes, care must have many answers.
Here at Ayus laboratories, we use different techniques to identify what lies at the basis of the symptoms a patient is experiencing. We use a more chemical approach by determining the type of toxins that are in a patient's blood or in a patient's eluate. What makes it special is that we are not looking only in blood, but we are also looking in the waste product, the eluate. So what is filtered out after Inuspheresis treatment. So this is the actual eluate that we're taking out of a patient. And as you can see, every eluate bag, it looks different. There's differences in content, in toxins, but also in color. So every bag of eluate tells a different story. What have I been exposed to? What is in my body and what has been taken out? And by sending the eluate to us, we can help you to answer that question. What is happening inside? So these eluates, they both come from a Inuspheresis. Here you can really see the difference between an eluate with a lot of misfolded protein and fat accumulation inside, as you can see here. And here's an eluate with little accumulation. Doesn't mean there's no toxins inside, it's just not visible to the naked eye. We see a rise in the amount of toxins people are exposed to, and on the other hand, we see a rise in the amount of chronic inflammatory diseases.
So we identified Inuspheresis as a very important puzzle piece overall to tackle this problem, because it is a very efficient and effective therapeutic method to basically approach the dysregulation of the human organism.
Inuspheresis is an innovative method of blood purification. You can think of a small little washing machine for the blood, because over time stressors build up. Heavy metals, pesticide, PFAS and microplastics, and also autoantibodies and inflammatory proteins the body produces under stress. Inuspheresis removes these harmful factors. The aim is simple: to lower the burden so the body can move out of dysregulation and return to a stable function. For the patient, the process is very simple and very convenient. Blood is drawn from a vein in one arm and goes to a separator where we separate the plasma from the blood cells. And then the plasma goes to a fractionator, and in the fractionator we remove all these harmful substances while leaving the beneficial components intact. Finally, the blood cells are reunited and they go back on the other arm into the body. This entire process happens outside the body under medical supervision, and it lasts for around 2 to 3 hours.
We have the largest center for therapeutic apheresis worldwide, and we have about 10,000 treatments per year, 200 patients per week coming for this treatment. The patients we are treating with therapeutic apheresis are mostly related to severe lipid metabolic disorders. That means patients that have at a very early age, they could be 30, 35, in their 40s, already a heart attack. So removing those lipids, this load of lipids that you can't treat with medications properly, is life-saving for them. They would have died many years if they were not at our center. So they get treatments on a regular basis, every week, every fortnight. Removing these substances is of course of great importance.
The challenge isn't probably one single factor. It's the cumulative effect of different stressors, and we call it allostatic load, that overall dysregulates the body. So our body actually has very sophisticated systems to detoxify. But I think with nowadays burdens that we have in the field of lifestyle, environmental toxins, chronic stress, sleep, bad nutrition, etc., this overall combination of stressors pull us towards dysregulation.
We are living in a time where we are exposed to constantly increase of external uptake, not only of toxins, but also medications. Everything is coming into your body. There is need, to my mind, for a technology that can also remove substances that have been accumulating in your body, in your fat tissue, in your cells, in your blood. Microplastics can be removed. That's the only method in the world where you can remove microplastics from the human body. And that is what I see as a major asset of therapeutic apheresis.
Inuspheresis is an extremely safe and well-established procedure. 10,000s of treatments have already been performed worldwide. It's a selective method. Harmful substances are removed, while the essential components of the blood remain. That makes the treatments both effective and very well tolerated.
Ayus Medical Group in the end, or the Ayus Collective, has as a goal to basically tackle this complex problem.
Inuspheresis reflects a broader shift in medicine. Instead of focusing only on symptoms, we reduce the underlying burdens to prevent the body from regulating itself. The global recognition we see shows that healthcare is beginning to change, moving away from a reactive care into a proactive solution.
For me, this shift is not just medical, it's human, because restoring self-regulation means restoring autonomy, vitality, and sometimes also dignity to people. And that, in the end, is what medicine should be about.
I think the burden we are carrying is global, and our response must be too. There is definitely a shift going on. It's rather slow, like probably a lot of things in medicine, but overall it's, I think, moving a little bit away from a pill for an ill model, more towards system-based medicine or functional medicine, where we try to analyze the root cause of many diseases. It is more complex, it needs more resources, but I think we are in a very interesting time overall with the help of AI to then also analyze this increased complexity and actually help patients and also physicians all over the world. This should happen and is happening all over the world. Because there is such a prevalence of autoimmune and chronic disease worldwide that we need to find solution.
When we are healthy, we can be there for ourselves, for our families, for our work, for our purpose. Without it, everything else fades. And unfortunately, for everyone, I see this in our patients, but also in my personal environment. Illness can be right around the corner. And that is why this mission matters so deeply to me.
The message is simple but powerful. It's not just about adding years to life, it's about adding life to those years.